happen to check to see the Kanye the Kanye meeting with Trump? And I do want to preface this by I am a firm believer in the destigmatization of mental health in America, and I think that what we're currently experiencing is the middle of a manic episode from Kanye West. That like he's just been on a mental health decline since the death of his mother. So I don't want to like just say, oh, this guy's crazy, what an idiot kind of deal.
Right.
But did you get a chance to like see that whole meeting?
I just saw some small clips of it. I will say I saw him in concert. I mean, it was amazing. It was spiritual, and I don't know. It just it was a Life of Pablo tour, and it was early on when he was really on it, and yeah, it was awesome. But I mean, we talk about mental health on the campaign trail all the time. Iowa was 51st in the nation in mental health beds. There's two things I tell folks all the time when it comes to healthcare. I'm open. I want to somehow find universal health care for everyone. But there's a couple things I absolutely need. And when I talk about mental health, I talk about right now farmer suicides are on the rise. That's unacceptable. And then we talk about 22 veterans a day for several years now. That's a stat that commit suicide. Those are unacceptable stats. We need to deal with this right now. And it's and I mentioned this at every one of my town halls. There's a lady in Mason City that came up to me afterwards, and she goes, I really liked what you had to say. I just want to tell you a story how my husband's one of those 22 a day. And so she had 3 little kids. She moved back to Iowa to help raise them with her family. And her oldest son was getting about 16 and was starting to struggle with mental health issues and the loss of his father. And so she started bringing him up to Rochester, and which is a hike, and she couldn't get him up there enough, and he ended up taking his life. And so now she's left with 2 kids, and her next daughter is dealing with PTSD from those 2 deaths. Yeah. And so she's driving down to Iowa City every week, but like she has to work. So and so she's just like, you know what? Iowa doesn't have the capability of taking care of my family or allowing me to take care of my family. And so she's probably going to move out of state. And it's heartbreaking.
That it really is, because you mentioned this in I believe it was Fort Dodge. Yeah, it was Fort Dodge. That when somebody does have a mental health episode that requires outside attention from within a family unit, that they're going to one of 2 places. They're going to go to jail or they're going to go to the hospital. Yeah. And both of those things, especially in people that the average working person in Iowa, they don't have the money for the jail, the court costs, and they don't have the money for these surprise emergency room visits. Right. So how does that get addressed, I guess, at a government level? Like, what kind of programs can be do any other states have solutions for those type of issues?
Well, it's one of those things that's going to have to be addressed, probably federally funded, but through states, like or something that's part of either Medicare or Medicaid, because so much of rural health right now is funded by Medicaid. And so in Iowa here, we've seen the privatization of Medicaid that's really hurt. And now at the federal level, if we keep the same Congress, they've talked about cutting Medicare, Medicaid, and Social Security, and because of the tax bill that happened. And I mean, if we cut Medicaid and funding to Medicaid, it's going to just devastate rural communities because like you go to nursing homes that are almost 100% funded by Medicaid, or so they're going to have to consolidate, or a lot of places are 60% funded by Medicaid, and so I mean those are direct impacts, and so you would have programs to help with that, either federal programs or state programs to help with that.
Awesome. So I do have a question that you might not be able to, like, you might not be the expert on this. Yeah. Which I think
it's probably the case. I'm not going to lie.
There's something to be said about, I hate it when something happens on the news and they're like, oh, this politician didn't have the exact answer for the question we asked. It's like, I don't want my politician to act like he knows the exact answer. I want him to go to the actual expert. You know? But the question is, what has happened with medical insurance to the point where, and I thought maybe I was crazy for thinking this, but I was able to talk to my dad, who is a PA,
Okay.
and about his thoughts on the whole system, and he also didn't have like the answer for what happened to the insurance system to get us to the point where I'm 28. I have no pre-existing conditions. I have no health problems. I don't go to the doctor. I think I've had one time where I actually had to go to like an urgent care in my life, and my insurance as from the free market as a freelancer is $561 without a month without any type of subsidies. That's $10,000 a year.
Yeah.
Over that. I don't know. It's like $6,000 a year over that. But yeah.
Math.
But yeah, exactly. Yeah. So, and then I was like kind of freaking out about that fact. Like where, like I start weighing the pros and cons of like even having health insurance. Cause what does an ER visit cost if I do have to go to one?
Right.
And I asked my dad, I said, you know, what is going on, and how do I fix my solution or fix my situation? And he said, I've seen the same thing happen with clinics where we used to basically like we don't get anybody in January and February because somehow the insurance system with all companies basically is turned to you have to hit like an $8,000 deductible before you even really see those copays kick in.
Yeah.
And even once you do there, a lot of them have like 20% in network or 40% out of network. So you see things like somebody's appendix bursting can cost a family $20,000.
Yeah.
So do you know what the systematic changes in the insurance industry have been to lead to this?
Right. And so, well, it kind of stems, and I'm not going to say I'm an expert on this, but this is my understanding of it, is back in the day, I think it was as a result of World War II or something, where people were trying to incentivize people to work in certain areas. And so they couldn't really do more pay, but what they could do is benefits. And so that's when you started seeing medical benefits relating to your job. And so that's kind of where it started at. And then as it's developed, these are private companies. So health insurance are private companies that they have stockholders. They're trying to make a profit. And you see right now that like 20 or to 30% of your medical bill is administration costs. And I mean that's when you're paying CEOs for all this money and or just upper management and stuff. It doesn't put the person first. And so that's one thing that I think is very frustrating is in our healthcare world, we're putting profit over care, and I don't want that. But in doing that, it's costing the American people. It's not efficient. People are getting broke through systems. And like when I was in my 20s playing minor league baseball, I mean, I was in the off season. I was jumping from job to job. I was maximizing my body. My shoulder was hanging on by a thread. I was lifting weights, doing everything, throwing all the time. There was times I didn't have health care because I couldn't afford it. And so I'm maximizing my body. And at that time, my health care was praying.
Yeah.
You know, I got super lucky.
Yep.
My catcher in college was playing AA, ends up getting cancer. You know?
Yeah.
And so what's the difference between him and I? I mean, just one got it, one didn't. And it's just pure luck. And so the way the system is right now, it's completely broke. And like we're paying the most per person, even before the Affordable Care Act. We were paying the most per person in all Western developed countries.
Yeah.
And so we're not getting a very good bang for our buck. And so that's why like Obamacare and the Affordable Care Act, it was a step in the right direction, but it was also a huge compromise. And so the big compromise that wasn't there, that wasn't put into it, was putting in a public option. So that's not a company. That's just the government having an option. And so they're not. The government's goal is not for profit. It's just to have a healthcare system right there.
Yeah.
And so that ideally would drive costs down because people, if you have the option to have something that's not for profit compared to the profits, most likely that's going to be the solution people will go to.
Yeah.
And for me, that's the first step for universal healthcare or Medicare for all.
Okay, so I do have a question about universal healthcare. Is that I'm not a big government guy. Just intrinsically, I'm really not.
Yeah, which is
But
okay.
but I do have like this I have like this thought process that I go through where I go, I've driven past plenty of insurance companies to know that they have these multi-million-dollar huge buildings, and it doesn't seem like they're hurting for money.
Right.
And I've driven past plenty of hospitals that have these giant medical campuses, and they're not hurting for money.
Right.
And doctors are all driving Porsches.
Yeah.
So, me as a private citizen, because the private citizens are the ones funding those campuses, right? We're effectively making two industries filthy rich, right, as it currently stands. So I'm kind of going like, maybe we could consolidate this, and it does make me go, maybe universal healthcare is the answer,
Right.
because then we can just like not make two
Right.
industries rich in the current system. And yeah, like how.
So
is there like a dollars and cents that I'm missing there? Because it seems like a no-brainer to me.
right. No, that's the issue.
Yeah. Yeah.
So and part of that is, you know what? I don't want the federal government part of the healthcare. I'd rather it not, but we've had decades for them to figure out a solution, and this is where we're at, and this is hurting the American people. When you still have millions of Americans that are not on healthcare, any healthcare services, and just, I mean, you even look at like a corporation that offers $10 an hour.
Yeah.
You work a hardworking 40 hours a week. But they don't offer benefits, so they're not making enough to pay for healthcare, so they have to go on government subsidies. Like, that doesn't make sense.
Yeah.
And so there's a lot of stuff like that, and so I figure, and there's so many different, like, you can get on Medicare, you can get on Medicaid, you can do it in private, and like bouncing around and all this stuff. I think just a Medicare for all would be simple. It'd be cost effective. And even the Koch brothers, the Republican, one of the big Republican donors, they came out with a study that said it would be one of the most cost effective and it would save billions of dollars.
Yeah.
And I don't want a bigger government. I don't want a smaller government. I just want a better government.
Yeah.
And I think this is the most logical step we could do.
I should also, like, something that like really hit home with me that I heard you actually say was the bankruptcies in relation to medical bills, which is
that's
like,
nuts.
It's insane to me. It is absolutely insane that, like, even when the American public is getting screwed on medical costs, the American taxpayer is then getting screwed again because of the bankruptcies incurred by medical costs. So go ahead and tell me those figures again.
Yeah. So 60% of all bankruptcies right now are medical related, and of those 60%, 72% of those people had health insurance.
Jesus.
You know, the system's broke.
Yeah.
And well, when I fill up, when I go to Casey's or stop at grocery stores, you usually see that donation box for someone who just got sick or someone who just got in an accident. Like, we have people begging in order to pay for their health care. And that, to me, we're the wealthiest country in the world. We deserve better. And you look at GoFundMe sites. 1 in 3 GoFundMe sites right now are for someone who's trying to pay off medical bills.
Wow.
Yeah.
And I had the opportunity to do videos on behalf of a homeless shelter here in Sioux City, and I guess I had always been I was raised, middle class in a small town, Sergeant Bluff, so I didn't have much exposure to homelessness. And from an outsider looking in, I kind of always was under the assumption that homelessness was the result of drug abuse or mental illness, which is unfortunate that that's even a fact, but that's what I thought. And after doing these videos with this homeless shelter, it was, I got cancer and I was working as a day laborer. I didn't have health insurance, so I'm homeless and I couldn't get any health care, or I couldn't get health care. So one guy rode his bicycle from Mississippi to Iowa to be able to go to the gospel mission and be able to find the health care he needed. Another guy had got like catastrophic cataracts, so he couldn't see and he couldn't work, and he had no way to get rid of his cataracts because he didn't have health insurance. And it's like story after story after story of people whose, and it's truly the, like you said, it could have been me just as easily, the guy that had this cancer pop up in my life that I have to deal with. And like the fact that can lead to homelessness in America is, I think, a tragedy of our current system. Right.
And so and like Democrats never talk about like their faith that much. And so like I have a pretty strong faith in myself, and our campaign's taken a pledge called the Matthew 25 pledge, and basically that's Matthew 25 is about you treat the most vulnerable is like treating me. That's what Jesus said, and so the pledge is to protect and defend the most vulnerable, and I mean that's it. Like like we're only as good as our most vulnerable.
Yeah.
And like playing on teams, baseball teams all the time, you're only as good as your right fielder or whoever like the weakest link is. And so like I believe that the like rising tides raise all boats, you know, and like that's what I want. And so often you hear like people picking on the people who are poor. And the people, they're like, oh, they're just living off of food stamps and all this stuff. And it's like, well, my vision for this district is not to have more people on food stamps. My vision is to have the jobs to lift us up and to pay for things. And you see stats like the average 30-year-old gets paid what a 30-year-old did 30 years ago. Wages are stagnant, but healthcare costs are at all-time high. Housing's near an all-time high, and student loans are at an all-time high. So people who are trying to do things right are not making it. And then you see like this tax bill that money goes to corporations and goes to the 1%. Well, the rest of us are still trying to struggle. And that's what I'm doing this for, is because I see my neighbors, I see the working class just really struggling, even though they're trying to do things right. And I let folks, when I do these town halls, the first thing I tell everyone is this stat, that the average person in Congress is 58 years old with a net worth of $1 million. I'm 20 years younger and $1 million short of that average. And I say it to get a laugh, but I say it because it's true. And like, there's enough folks in DC who are fighting for tax cuts and to get more money and all that. But what about the rest of us who are just trying to earn a dollar to raise our family and do things the right way, and yet we're not making it? And that's what I feel is missing in DC. And I mean, like you mentioned earlier, like I could give a rat's ass about name recognition or anything. Well, I need it for the to win the campaign, but
fame,
like fame. Like, you know what? I don't care. I want to represent my people and just work my tail off and engage with the community and represent them in an honorable manner out in DC. And I could, when I'm there, I don't care about special interests. I don't care about lobbyists or all that stuff. I'm working to fight for the people of this district.
Yes.